When I arrived at Elmhurst 15 months ago, we were, and still are in many cases, a very siloed organization. The HR department just structurally was also very siloed in its approach to the delivery of HR services. So what the Total Rewards program has been able to do, I think, for our organization is bring about integration. And I think for the first time, the employees and our management as well, and our board and our community are beginning to see that human resources is more than just the sum of a lot of individual pieces of a puzzle, and that it's telling, the Total Reward story I think tells a story that now puts into context for our employees the total picture of why it is that they've come to the organization. What do we expect in exchange for what they bring to our organization, and then what rewards they'll receive as a result of that. So it's been crucial, I think, to helping us with not just total rewards, but with the cultural issues that we're trying to bring about. I think some of the changes that we've made in the health plan, some of the changes that we've made to our pharmacy plan have already begun to reap those dividends for us, to the point where next year I'm not anticipating some large increases either on behalf of the organization or premium increases for the employees, and I think we will be able to redirect some of the savings that we've seen into some of the other areas like learning and development and certainly our work environment, so that we can begin to more focus more on something that's very important to us, which is our engagement scores, because our engagement scores, we think, are going to be directly related to the amount of patient satisfaction that we see when we survey our patients after having had a service or a procedure at the hospital. The economy has had a tremendous impact on our business. One of the things that we're seeing is the amount of individuals who are coming in for services at either our clinic operation or the hospital operation, who when they arrive for the service may be insured, but by the time the service has been delivered, they are unemployed and the insurance company will therefore not reimburse us. Okay, so that has caused us to experience a dramatic hike in the amount of charity care, which comes right off our bottom line. The other thing that we're beginning to see is that patients, potential patients, are really having to make a critical decision, which is unfortunate for them, about whether or not they're going to go buy groceries, pay their rent, pay their mortgage, whatever it is, or come in for a procedure. So we're beginning to see a decline in office visits in our clinic division, and we're also not seeing the inpatient part of the hospital operation where we would like to see it. So those have been two big impacts that we've seen on the business. Now, from a total reward standpoint, I'm feeling very good that even though our merit budget for the year will be less than last year, some of the work that we did in year one, a reduced merit budget will still allow us to be competitive to the marketplace. So I'm feeling pretty good about where we are with our employees at this point in time. And we're just keeping our eyes day to day on the impact to the business because of the macro economy. We gingerly moved into an account-based plan, and I will tell you, we gingerly moved into it. While I believe that it will be an important piece of our portfolio in the future, we really wanted to take it easy going into it. So year one, while we introduced a look-alike plan, I really didn't do the amount of marketing and advertising that I think is necessary for that type of a program. This year you'll see something very different. I will be out and about starting in the July-August timeframe with heavy marketing campaign to make sure that the employees understand the value proposition behind the account-based plan. At the same time, we'll be evolving our look-alike to either an HRA or an HSA, and a lot of that will depend upon what we think is going on in the political landscape around us, but we'll be moving in that direction for sure. I believe fundamentally that employees are good people. I think that they're hungry for information. I think they're very smart people. And I think if you present data to them in ways that allows them to see that you're not trying to pull the wool over them, you're not trying to cloak things up, the more you can get them engaged in what it is you're trying to educate them about. So yes, we will be out and about doing those things. We'll be showing them examples of how they might be able to benefit from this. I am also an active campaign about retirement, so this will be an important ingredient because I'm fortunate because in my organization we have a DB pension plan. It's slightly above market at this point in time, and so I think our employees, because we haven't communicated to them, do not really understand what we as an organization have done to help provide for their retirement. So I think our 403B, in concert with our DB pension plan, in concert with let's say an HSA plan, will really help to, again, put a story in place for our employees. And I think people understand stories. I want to be one of Fortune's top 100 places to work. So my campaign that I'm on is to really help our employees understand that we value and respect what they bring to us, their good skills, their abilities, their interest in providing the kind of care that we want them to provide, and that in exchange for that, we will provide them with the best, maybe not the best, actually, let me reframe that, with a competitive package so that it's as good as anywhere else that they're going to go, all right? But it's our environment. It's what we stand for as a health system that will make it be the best place to work.